There's a question men over 60 ask me all the time, but usually in private. Dr. Blake, how many times a week should I be having sex at my age? Is it normal that I can't perform like I did when I was younger? And honestly, the fact that this question gets whispered instead of discussed openly is part of the problem. Today, I'm answering that question clearly. We're talking about how often is healthy, what's realistic, and why the number matters way less than you think. Because here's the truth, sex after 60 isn't about keeping up with your younger self. It's about connection, pleasure, and understanding how your body works now. I'm Dr. Emma Blake, your trusted men's health advisor. And make sure you watch closely because what I'm about to share around the halfway point will completely change how you measure sexual satisfaction. If you want straight answers about men's health after 60, no shame, no judgment, just science, hit that subscribe button because we're going deep today. All right, let's start with why sex changes after 60. Because understanding the why helps you adapt instead of fighting against reality. First, testosterone naturally declines. This hormone fuels libido, erection quality, and energy. It starts dropping after 50, and by 60, the decline becomes more noticeable. Now, this doesn't erase desire, it just softens it. You're not broken, you're aging, and there's a big difference. Second, circulation changes. In your younger years, blood flow to the genitals was strong and instant. But as you age, especially if you're dealing with high blood pressure, diabetes, or cholesterol issues, blood moves more slowly, and erections depend on blood flow. Less circulation means weaker or slower erections. That's not failure, that's physiology. Third, medications. A lot of men over 60 are on drugs for blood pressure, diabetes, or cholesterol. And many of these medications have side effects that affect sexual function. Beta blockers, for example, can reduce libido. Diuretics can affect erection quality. If you're noticing changes and you're on medication, talk to your doctor. Sometimes a simple adjustment can make a huge difference. And finally, psychological factors. Some men feel like they're not the same as they were in their youth, and that mindset alone creates stress, which makes everything worse. Because stress kills erections faster than almost anything else. So here's the summary. These changes are normal. They're not a disease. They're just a new phase of sexual life that requires awareness and adaptation. Now, let's answer the big question. How often is normal after 60? Here's the truth. There isn't a universal number. It varies from person to person. Studies suggest that the average for men in this age group is once or twice per week. Some couples are perfectly satisfied with once every 10 days, and that's fine, as long as both partners are happy. I had a patient, 65 years old, who has sex with his wife twice a week and feels great. Another patient, same age, manages diabetes and high blood pressure, and he's comfortable with once every 2 weeks. Both are normal because each found a rhythm that matches his health and relationship. The important part is listening to your body. If you feel energy and desire, go for it. If you're drained, reduce frequency. There's no scoreboard here. The goal is satisfaction, not performance. Now, here's where most men get stuck. They ask, but Dr. Blake, I can't last longer than 3 minutes. Does that mean I'm failing? Absolutely not. Studies show the average duration of intercourse at this age is 3 to 7 minutes. But here's what most men miss. Focusing only on penetration time is misleading. Foreplay, touching, kissing, holding, whispering, that can last 15 to 20 minutes and matters just as much, if not more. Emotional closeness, sharing warm and affectionate moments, is the true foundation of intimacy. So don't measure success in minutes. Measure it by the level of happiness and connection you share with your partner. Now, how do you know if you're doing too much or too little? If you feel exhausted, short of breath, or have chest pain after sex, the frequency or intensity is too high for your current fitness level. That's your body telling you to slow down. On the other hand, if there's emotional distance or disconnect with your partner, that might signal the need for more physical intimacy. Balance is key, not excess that strains your body, and not neglect that weakens your relationship. So what can you do to improve sexual health after 60? Let me give you some practical strategies that actually work. First, physical health. Walk for 30 minutes daily. This boosts circulation, strengthens your cardiovascular system, and directly supports erection quality. Seriously, walking is one of the best things you can do for sexual health. Second, eat nutrient-rich foods. Salmon, walnuts, almonds, foods high in omega-3s and zinc. These support testosterone production and improve blood flow. And honestly, what's good for your heart is good for your erections. Third, quit smoking. Smoking narrows blood vessels and undermines erections. If you're still smoking after 60, you're actively working against your sexual health. Fourth, stay hydrated. Dehydration lowers energy and impacts desire. Drink water throughout the day. It sounds simple, but it matters. Now, let's talk about mental health. Don't compare yourself to your younger self. Your body is evolving naturally. Expecting to perform at 65 the way you did at 25 is setting yourself up for frustration. Talk openly with your partner. Honesty relieves stress and deepens intimacy. If you're struggling with erections or stamina, say it. She's probably noticed anyway, and pretending everything's fine just creates distance. Practice relaxation. Meditation, deep breathing, even yoga, these reduce tension and improve circulation. And less stress means better erections. Now, what about supplements and medications? Some men benefit from zinc, vitamin D, or magnesium. These support testosterone production and overall health. Medications like Viagra or Cialis can help with erections, but you need to consult a doctor first. And here's a critical warning. Never combine these medications with nitrate-based heart drugs. That combination can be extremely dangerous and potentially fatal. So if you're on heart medication, talk to your doctor before taking anything for erectile function. Let me answer a few common questions I get all the time. Does having less sex harm my health? Not necessarily, but regular sex does support immune function, better sleep, and heart health. So while you're not going to get sick from having less sex, staying sexually active does have health benefits. Can too much sex be harmful? If you're healthy, no. But overdoing it can cause muscle fatigue and exhaustion, especially if you have chronic illness. Listen to your body. Does sex stop at a certain age? No. It's not age-based. It depends on health, desire, and mutual interest between partners. Some men are sexually active well into their 80s. Others slow down earlier. Both are normal. Now, let me talk about habits that damage sexual health after 60, because awareness is the first step to protecting yourself. First, staying up too late. Sleep is when your body repairs itself and regulates hormones like testosterone. Consistently going to bed past midnight disrupts your sleep cycle, lowers energy, and weakens sexual drive. Aim for 7 to 8 hours of quality sleep. Second, excess alcohol. An occasional glass of wine is fine, but drinking too much over time damages your liver and nervous system, both of which play a role in erections. Alcohol also dehydrates you, leading to fatigue and reduced desire. Moderation is key. Third, ignoring chronic conditions. Diabetes, high blood pressure, high cholesterol. These directly affect blood circulation, which is essential for erections. Skipping medications or delaying checkups can silently harm your sexual health. Stay on top of your health. And finally, isolation and depression. Emotional health is just as important as physical health. Loneliness and depression reduce dopamine and serotonin, brain chemicals that fuel desire and pleasure. Stay socially active, nurture your relationship, and seek support when you need it. Here's my final message. Sex after 60 isn't a competition. It's about connection, comfort, and shared love. Taking care of your body and mind, embracing changes with awareness, that's the secret to a satisfying sex life well into your later years. If this gave you clarity, hit that subscribe button. Drop a comment and tell me one thing you're going to change based on what you learned today. I read every single one. Thanks for watching. Take care of yourselves.